We're just preparing the live stream, but attendees should start filtering in now.
Good morning, Carolyn.
Okay, we're all set. Whenever you're ready, Matt.
All right, well, thank you, everybody. Welcome to our webinar on risk mitigation strategies for church choirs. My name is Matt Ashley. I'm the South District Superintendent, and we're glad that you've joined us today. I'd like to start with a word of scripture and then a word of prayer, if you'll join me in centering our hearts and minds on God today. This is from Ephesians, the 5th chapter, verses 18b and 19. Be filled with the Spirit as you sing psalms and hymns and spiritual songs amongst yourselves, singing and making melody to the Lord in your hearts, giving thanks to God our Father at all times and for everything, in the name of our Lord Jesus Christ. Let us pray. Lord, we are grateful to gather today, and we are grateful for this time of conversation with Dr. Schauer and with Carolyn. Lord, would you bless us and help us to be wise in how we worship during this difficult season. Would you restore us to that time when we can be together and when we can sing together? And until that day, grant that what we sing with our lips, we may believe in our hearts, that what we believe in our hearts, we may practice with our lives. Thanks be to God. Amen.
Amen.
So several months ago, I received a request from St. Mark's United Methodist Church and from Dr. Elizabeth Schauer, who is one of the choir directors there, to begin an exception request to be able to meet outside for outdoor choir rehearsals. And it was a really well-written document with some really thoughtful ways to stay safe in doing that. And that led to some conversation between the annual conference's COVID-19 response team and Dr. Schauer, and she gave us some assistance in thinking about safe practices for singing together. And that led to the idea of this webinar on risk mitigation strategies for church choirs. Now, this is not the time to get your choir back together. We've had spiking rates throughout the annual conference as well as throughout the country. So we don't want you to rush out and put these into practice right away, okay? So I want to emphasize that this is not the time to do that. But we do want to help you think about safe ways that when it is time for choirs to come back together, how you can be safer doing that. And so I'm really grateful. Dr. Schauer is, as I mentioned, on the staff at St. Mark's. She's also on the faculty of the University of Arizona's Fred Fox School of Music and has some really incredible, done some really incredible work in helping her choirs at the U of A stay as safe as possible. So she's going to share some of those thoughts with us today. There is going to be a recording of the webinar available. That's going to be on the DSC website on the COVID-19 page. Just look for the webinar section and you should find the link there in future weeks and months. So this resource will be available to you in the future if you or somebody from your ministry wants to come back and look at it. With that, I think I've covered everything I need to cover. So I want to invite Dr. Schauer to please share with us. Thank you for joining us today, Dr. Schauer.
Thank you so much for inviting me and for leading us off that way. And I also want to introduce to you Carolyn Yaussy. Carolyn's going to be sharing with us a little bit later on in the webinar, but I'm incredibly fortunate to have Carolyn and her husband Drew. Both are members of the Chancel Choir and also happen to be video and audio specialists. So we're going to talk about that component of what we've been doing as we get going. So this is called risk mitigation strategies for church choirs because that's what we're talking about. There's no completely safe way to be gathering again. And as Matt said, it's important to remember that there's an appropriate time for gathering, and it's not now. So I guess I'm a little persistent about checking every day what the rates are in our state and in Pima County. And during this last week, we've had some of the highest rates of new infections and deaths in our state. And so we are not meeting in person right now, but I'll talk to you more about that later. But it's important to remember, I think. Okay, so this summer, can you see the whole screen? Is it blocked? Okay. This summer, I spent a lot of time studying all the research that was available, actually starting in March when our university went to online only after spring break. And a lot of people at that time in chat groups were saying, well, these decisions are going to be made above my pay grade. And I thought, but what if the people above our pay grade don't know all of the things that are specific to choral singing? So I'm going to make sure that I learn everything that I can so that I know if they're making good decisions or if I need to talk with them more about those decisions. And one of the first resources that came out, which was pretty devastating, was a webinar called A Conversation, What Do Science and Data Say About the Near-Term Future of Singing, supported by National Association of Teachers of Singing, NATS, American Choral Directors Association, ACDA, Chorus America, Barbershop Harmony Society, and Performing Arts Medical Association. And the link is there. This is a 2.5-hour webinar, and it was really hard to listen to because they really told the most dire truth about what was happening. And they commissioned some research studies. So a lot of people found these findings at that time very hard to believe. But what I decided was if I believed the harshest bit of information, that I could probably come up with the safest circumstances. So there were multiple studies that came out as a result of this, and I'll talk about those in a minute. The other resource that I follow is CIDRAP, the Center for Infectious Disease Research and Policy out of the University of Minnesota. That's existed for a long time. Dr. Michael Osterholm is the person who's most associated with that does a lot of webinars. And he has a great deal of experience. One of the things, he was an integral voice in discussions following the AIDS epidemic. And when other people were saying, we'll have a vaccine in 2 years, he was saying, we probably won't have a vaccine in 2 years. And he got hate mail and everything because of that. But then you know that he's going to be honest even when it's hard. The other thing I like about him a lot is he's a Lutheran church attender. So he knows a lot of the things that are specific to church situations and to choral music. So he continues to be a great resource. He's just been named to the COVID team for the next administration nationally as well. So some of the things, some of the cases, I'm sorry, having a little trouble there. Some of the notable outbreaks related to choral singing that happened early on, this is just a few of them, but this is the most famous one, the Skagit Valley Chorale in Mount Vernon, Washington. And this is at the beginning, nobody was acting intentionally with ignorance or to contradict what we knew at that time. They thought they were being safe. There were 61 people for a 2.5-hour rehearsal, 32 confirmed cases, 20 probably secondary cases, 3 hospitalized, and 2 died. And then in the Amsterdam, there was another situation where 102 of 130 people became ill, and 1 choir member and then 3 partners who they went home to infect died. And then in Berlin Cathedral Choir in Germany, 80 people, 60 people became ill. There were many other outbreaks, and some related to churches, including in Tucson, not Methodist churches, and other things that involved singing and speaking. And each of these groups had some risk mitigating strategies, but they didn't have enough information at the time to be safe, especially I'm sorry, it's jumping around. Especially the Skagit Valley Chorale Choir director felt horrible and provided as much information as possible so everybody could learn from their misfortune. So the studies that came out, University of Colorado Boulder was a specific commission study related to that webinar that I mentioned to you. And they gave out 3 different sets of results. These were specific studies to singing and wind instruments and also speaking. So it was by arts groups. So like for theater. And then this study is being duplicated at the University of Maryland. So this is where some of my information came from. And the studies that they did, the other information was informative, but these were specifically about what it is that we do. And then there was another study done at Colorado State University about performing. And so this is where some of the information came from to figure out what we needed to know. So what did we learn? We learned back then, before the CDC admitted it or whatever, that the virus is spread through aerosolized particles and droplets. We knew from those cases before that would be the only way, the only thing that could explain that level of contagion in those particular circumstances. Singing, humming, speaking, especially when projected, and playing wind instruments all generate aerosols. And aerosols can travel a great distance, and fans and HVAC systems can distribute them. So some of the studies and cases are related to that. In addition to the virus making people severely ill now and or being fatal, it can also have negative long-term effects. In the singing community, people are particularly concerned about that because it can have an impact on your lung capacity. So professional singers had particular concerns about that, even if they didn't get very sick, or even if they got better after being very sick. There are risk mitigation protocols, but until everyone can have the vaccine and or effective treatment is available, we can't return to choral singing as we knew it before. And effective treatment, early on there were some conversations about there's some kinds of things that can reduce the symptoms to that of a common cold. We know that some vaccines are on the way, but probably won't be here fast enough to get us immediately back to choral singing. So, and the aerosolized particles, one of the things that helped me to conceptualize that when Dr. Osterholm would talk about it was when you go into a department store in the mall and you smell perfume from aisles and aisles away, those are aerosolized particles. So that helped me to really think about, in a more specific way, how far away those kinds of things could travel. So, what are our priorities? Your number one priority, my number one priority, is to ascertain that no one gets sick or dies because of me, my leadership, or my choices, or my example. And I think that is really crucial, that we make sure that we know that people trust us. And if we tell them that it's going to be okay for them to come back, they're going to believe it's going to be okay for them to come back. So that is my number one priority. My number one priority and your number one priority is not to have choir again, or have choir in some particular configuration. So this requires a little bit reimagining what choir means for right now. And I want to, I just added this back in, but I want to restate that we shouldn't start meeting again until transmission is low and declining in our areas and hospitals aren't at capacity. So we did start meeting again in the fall, but we have stopped meeting now, and I'll give you more information about that later. Risk mitigation factors. One of the biggest ones for Insight is good air exchange rate, which is an exchange rate in a hospital of 10 to 12 times per hour. Just for perspective, at the university, I think our air exchange rate is 4 to 5 times per hour, which is pretty good. Many places it's 1 to 2 times per hour, and many places don't have a system that exchanges their air. And literally that means all the air from that room has come out and been filtered and then come back in that many times per hour. So outside of possible is better, although there are some caveats for that too. A recent study that I read says that people tend to be less cautious outside, so they think they're safe, so they stand closer together to each other and talk, or they don't wear masks and they think they're safe because it's outside, and that's not the case. So physical distance is crucial. We've heard 6 feet generally for moving around and so forth. We've been doing at the university 12 feet anytime that we're singing or playing instruments. And when we were singing also at St. Mark's, 12 feet. People tend to have a bad perception of how far that is, so I'll talk to you about what our protocols are for making sure. Well-fitting surgical style masks. Well-fitting means that it should leave a little imprint on your face, if at all possible, after you've worn it for a half an hour or an hour. There are two kinds of singers masks that have come out. One is called the resonance mask, and I think the other is called the Broadway Relief Singer's mask. Those are not as effective as a regular well-fitting mask, okay? Smaller groups, large space if inside, and then the big one for me is limited time, 30 minutes together. 30 minutes, from what I can determine from all that I've encountered, is the maximum amount of time that you can be together and be safe, and when I say, or mitigate risk. And when I say that, my assumption is that there is always somebody with us who has the virus. I try to assume that whoever I am with may be an asymptomatic carrier of the virus. And so 30 minutes is the maximum amount of time you could be with someone who has the virus and hopefully also then not get it. Limited contact of equipment, materials, no plexiglass barriers. That was something that was suggested early on. But if you are inside and you have a good air exchange, they have a negative impact on the air exchange. They also don't protect from aerosols. They can only protect from any kind of droplets, like if you coughed, for example. Face shields, again, provide sort of a false sense of safety because you can imagine that aerosols can go all out and all around them, so they can protect you from droplets, but not from aerosols. So a face shield alone was not effective mitigation strategy. If you want to wear one with a mask to prevent droplets, then that's a possibility, but not alone. So this is a graph, this is a graph that I think is hard to see in this webinar, but this is from the British Medical Journal of the British Medical Association. And what I like about it is that it provides a lot of clarity in an easy to understand way. So if you look at this part of the graph up here, type and level of group activity, low occupancy, outdoors and well ventilated, indoors and well ventilated, poorly ventilated indoors, silent speaking, shouting, or singing. So this is low risk and this is medium risk. So this is the best block right here. And then here's for prolonged time, no face coverings, contact for a short time, no face coverings, contact for prolonged time, and this is for high occupancy. And when you get down to here, you can see that that is the most risky situation. So here is where I'm living, in all the, only in the green area. Protocols. So first of all, people who are in vulnerable populations should not attend. And you can go back to these slides and you can find people who are in vulnerable populations. People who have symptoms associated with the virus or who have been around anyone who has symptoms should not attend, including a temperature of over 100.4, and you can find those symptoms here. People who have tested positive or been around anyone who has tested positive should not attend, and people who have traveled outside of your immediate area or state within the last 2 weeks should not attend. So the first part of the protocol is keeping people out who are vulnerable and people out who might have the virus. Nothing is too obvious, I think. Okay, so then the other protocols, outside if possible. If inside, then large space, sanctuary, or concert hall. And just to be clear, the place that we've been rehearsing at the university is a 2,000 seat hall, concert hall, and I know that not everybody has access to that. So singers should be screened before entering, and we'll talk about that in a minute. At the university, I don't have that capacity because of HIPAA rules, so I'm grateful to have that at the church. Well-fitted masks that cover nose, mouth, and chin at all times. And I say this because I've had 2 instances where people have come in without a mask or thought that as they were providing some leadership or something, they could take the mask off to speak, or somebody came in holding their mask up that wasn't on. No, I'm not willing to get sick and I'm not willing to risk anyone else. So those have to always be on. 12 feet of distance between singers when singing. 6 feet of distance between everyone at all times. And this is maybe one of the hardest parts because when people come to speak to each other, with the mask on especially, it's hard to hear standing 6 feet apart. And that's not our regular practice to stand 6 feet apart when we talk. And sometimes it's hard for people to conceptualize how far that is. And so you have to be in charge of that. And I'll talk to you more about that later. Small groups only, depending on the space that you have, how it allows for 12 feet between everyone in all directions, that might have an impact on that. But we're going with groups of 10 or smaller, and that includes everyone. More on that later too. More protocols, 30 minutes max, which also means don't come early, don't stay late. Wait outside the rehearsal space if you're early and depart immediately. Another important part is adjust musical expectations. So don't pull out your best SATB to VC anthem for your 8 people. Remember that people might have to miss. They might come into contact with someone from the virus. So if you have 8 singers, yourself and your collaborative pianist, and then 2 people get sick, then you want to plan. We've done mostly unison and 2-part music, and that's fine because people get to sing together again. And then with our recordings, people get to hear people sing together again, and they don't care that you're not doing. I mean, maybe they do, but you want them to sound good. Okay, make sure you get an okay from all participants if any protocols change. So for us, we were initially rehearsing outside, and when I did the initial proposal, it was extremely hot here, so we were meeting at 7 a.m. on Sundays. And when it got cold, then we asked the people who are signed up to sing for that particular Sunday if they would be comfortable moving into one of the large inside spaces, and got approval with them before they showed up. Preset the chairs 12 feet apart. Singers from the same household can sit together. That way you're not having to touch equipment, and also then they don't have to figure out how far 12 feet apart is. You can do that. Preset music, pencils, etc., so there's no passing out of materials. I also emailed the music in advance to my choir members and gave them a recording. So I'll tell you more about that later because we're still just talking about general protocols. So at St. Mark's, we based our protocols on successful approaches that the Columbus Gay Men's Chorus had been already doing for 2 months. They had been rehearsing outside this way. And also at the University of Arizona, our choral groups had already been meeting for 2 months before we started. And they had been using these protocols that I had come up with. And we had an interesting phenomenon was we did have people who knew they had come into contact with somebody who had COVID, so they just stayed away. We had someone who started to have a fever and a sore throat, and they stayed away. They turned out to have strep. And we did have a case of COVID in a choir member, and they stayed away. And something that was really interesting was that in October, those of you who are teachers know that often all of your choir members get sick, or one person has strep and then 6 people have strep, or one person has a cold and then 10 people have a cold. We didn't have that. So we know that our protocols worked for us because it kept people from getting any of those things in addition to not getting the virus. At St. Mark's, I told the choir of the available rehearsals and asked for people to let me know their availability after discouraging vulnerable people. I was very grateful that most people in vulnerable populations opted out, and they felt apologetic in their individual email responses to me, and I just thanked them because I didn't want to have to make that decision for them. And I was very grateful that they helped us create as safe of a situation as possible. So then I selected 8 singers for each experience from those who said they were available on that Sunday. And then plus myself and plus our wonderful accompanist, Sandra Franks, that made our 10. I assigned a door monitor to ask the screening questions, which we're going to come to in a minute. We rehearsed for 15 minutes, we recorded twice, and we stopped at 30 minutes. I also thought it was important to make sure that distance was visible in the videos so that we were a good model. And that is a challenge, which maybe Carolyn can tell you a little bit about later. You know, you want everybody to be in the shot. So if you did a long shot where you could see 4 people, That would be nice because you could see those 4 people, but it might not show that they're in fact keeping good distance. So then, as in all things, we learned as we went and tweaked some of the approaches related to that. So, okay. Da, da, da. Okay, I'm going to try that one more time. Sorry, friends. So now I'm going to ask if Carolyn will talk a little bit about what we've been doing in terms of video and audio recording. Carolyn is a producer for on-air promotions for Arizona Public Media. And so I feel very fortunate that she and Drew are in the choir, but also they've done a lot of work to help St. Mark's be online in services. And should I stop for questions before we move to that, or keep on keeping on? I can't see the chat if there are questions so far. So, okay, well, let's keep going. So,
any questions, so I think we can go on.
Okay, all right. So, Carolyn, please go ahead, and thank you for being here and joining today.
Well, thank you for bringing me on board. My husband Drew and I are both video professionals. My husband works at the local CBS affiliate as a commercial production manager. So we just sort of fell into doing this sort of thing, and since we happen to be in the choir. And just to sort of, support what Betsy is talking about with the amount of people. In our specific case, Drew and I are both part of the same household, and we are both in the choir. And so we sort of count as one person when we're working together to do video. And because we can also be in the choir, then we are able to have the full number of singers that's available to us in our space. But I just felt it was important to point out that if you find yourself, if you're not in that situation and you have to have someone else come in to record, obviously they would need to be counted in the total number of people. So just a little bit of caution there. And then we don't use high quality video equipment. We're using fairly low cost things, a combination of the GoPro camera. We have a DSLR camera that's probably the nicest thing we have. But if you just have a cell phone or a few cell phones that you want to set up, those are perfectly sufficient. And the biggest thing you want to think about is getting a wide angle lens, because that is the best way you're going to be able to get close enough to the choir, but also to get good audio, but also be able to show that people are physically distanced. And I think that's, really, really important to show that. But just on that note, if you don't have video editing equipment or access or someone who knows how to do that, I would suggest just using one camera or cell phone so you don't have to worry about editing, because you're not going to have any way to join those two things, to join all of those things together if you don't have an editor. And the other thing I put on here is if you are going to use a cell phone, I would suggest getting a small tripod, like we have this one. And it's just a way that you can put your phone on the tripod and then set it down somewhere so you know that you're getting a good angle, the camera's not going to move around. And certainly if you also have a choir member who is recording it, then they would want to put their phone somewhere far away that can capture the whole group. And then as far as audio, if you do have the ability to edit, I think it's really good to have some sort of other recording device to, that's put away from the camera in a position that would capture more of the choir's sound. So that could be another cell phone. Or if you happen to have a microphone, there are multiple ways of doing this, and there's a lot of little devices out there. Like if you have an iPhone, you get an iRig and actually connect a microphone to it. But whatever equipment you have, I would, if you're able to edit video, I would definitely suggest recording audio separately. So and another thing that we've kind of learned, so when we first started doing this, we would come in right at the time that the choir was supposed to be there. I think the first time we were there like maybe 2 or 3 minutes early, and it was just like a mad dash to get everything set up. And because we only have 30 minutes of time that we can all be together. So we started coming about 15 minutes early to get everything set up. And our setup is, it's a little more complicated. We generally use 4 cameras, and part of that is to get audio because we're recording audio on all of those cameras. But we just realized we need more time. So we get there early, but we are not in contact with any members of the choir until, it's time for people to show up. So that 30 minutes of time that we have blocked out is for everybody, but it's just good to be aware that for the technical side of it, there's going to be some setup and tear down time. And so we've had pretty good participation at St. Mark's with when it's time to leave, people just leave. And so we're able to tear everything down in safety. But it's just that time needs to be built in, and it's going to change depending on what your setup is, the amount of time that you have.
Sorry. Okay.
So,
and go ahead.
So I guess, are you going to play the video? Or?
I think I was supposed to download it before, and then let's see if it works. We'll see what all. This is an example from this fall, so let me make sure I have not shared my sound yet. Hold on. Ooh. I don't think this will be great sound quality.
From the fount of every blessing, tune my heart to sing thy grace. Streams of mercy never ceasing, call for songs of loudest praise. Teach me song, hallelujah sonnet, sung by flaming tongues of love. Praise his name, I'm fixed upon it, name of God's redeeming love. Here I raise my...
I think that's okay.
Yeah.
So I think that's a good example. And we decided some things after that, like that maybe we would move the folded chairs or something. But the main priority was for the people to be able to sing together again. And we also then, if it was possible, we also wanted to be able to create something for worship. And we did. And I think that sounds good. They're just singing in unison. I think it's a 2-part piece, but I just made it unison. Carolyn, anything else about this?
Well, kind of like how you have to adjust your expectations for what you can do musically. It's the same thing with video production. I mean, this is not a high-end production, but it serves its purpose, and it's something that I think that people enjoy. And I think in this time, it's really good for people to see familiar faces that they're used to going to church with. So this, I mean, for that, this is a really, really good thing to do. But I mean, as a video producer, like there's all sorts of rules that we broke because you're not supposed to put 2 wide shots together. But in this case, it's important because you have to show that everybody is distancing. And, the audio isn't going to be the best quality audio that you could record because of, I mean, I think even getting microphones around people and having aerosol and droplet particles landing on microphones is something that you have to be concerned about. And so you have to adjust your expectations, but I think as long as it's understandable and it's going to, enhance people's experience of being in a worship service, then I think it's worth doing.
Yeah, and I really appreciated that Carolyn and Drew had early on said, it means a lot to people when they can see the faces of other people. So we had used initially, everybody was scrambling and we would just find recordings of a choir and get permission to use them for the service. And then we started finding some old cantata performances we had done from the past where we could use the actual voices of our choir members, which was meaningful to people. They liked being able to hear our choir singing. But the faces were a really important part and really meaningful to people. So, and of course, a lot of these people, even that you see here, they live alone, and they have really been alone for most of the pandemic. So this was powerful for them to be able to be together. Anything else on that, Carolyn?
No, I don't think so.
Okay. I feel like I might have skipped a slide in my jumping back and forth, but let's see.
Mm.
So cautions and final thoughts. These are risk mitigation approaches. There is no completely safe, singing or safe contact. So your goal is to mitigate the risk as much as possible. Use foolproof communications. So when you're listing what it means to be in a vulnerable population, don't put a link in your email that you're going to expect the people to go to, right? List them succinctly so that people will do the stuff they will read. Please know that it's hard. You probably already know it's hard to hear with masks and distance, and you just have to accept that, right? It's going to be a different kind of singing, and so unison is also better than the part singing. You have to be an enforcer of rules, and that's not always fun, but you have to take it seriously, right? So my biggest thing is both at the university and at St. Mark's is that's not 6 feet. Get away from each other. Put your mask on as people are coming in. And it's not pleasant. People look at me like we're just talking and it's after. I'm like, not while I'm here. Move apart. And I try to encourage my students at the university and the singers, actually at the church, they're great. Get used to the protocols. Don't get tired of them. And then the other thing for me is really care for those who can't come too. It's been very hard for everybody not to be able to sing together, but maybe it's even a little harder for the people who can't come back when some people can come back. So we have tried really hard to make sure that there are experiences that keep those people connected and feeling supported with our choir family. We do a Zoom meeting every other week. And either we just visit with everybody, or maybe we share a Christmas tradition. And then right now, even though it's Advent, I find Christmas carols online that have the text so that we can sing together. And then we have a retired pastor who's also in the choir, and she leads us in prayer at the end. But maybe make sure that you really connect with the people who now can't come back. Of course, things might change pretty quickly when we have a vaccine, but it's hard to know. And again, I think, let me just double check. We are done rehearsing. Yeah, we would meet 2 weeks before, sorry, I can't find it. We were meeting 2 weeks before the service that we needed the recording for. And so we finished, our last rehearsal was November 29th, and I am so glad that we are done, because I do not want people meeting right now while the case numbers are going up, because the likelihood that someone among you has the virus is now pretty great. And I'm going to make a schedule for January and moving forward, but we won't start meeting again until those numbers are back down where they were before, because it's just not worth it. That's not worth it. I don't want to bring it into my family. I don't want to make any of my beloved choir members or their family members sick. So I think that's everything. Carolyn, is there anything you can think of that I've missed, because you've experienced a lot of this?
No, I think you've covered everything. One thing I did think of was, I don't know if anyone is thinking of doing virtual choir, but just know that is a much more time and production intensive project. And as we've experienced, it's very dependent on the technical skill of the people who are involved, such as, your choir members. So it's not something I would recommend unless you are very confident that you can do it.
We did create one audio-only virtual experience for our choir members, which was singing 2 verses of Silent Night and parts. And as part of that, we provided training for them on Zoom, and then for some of them even one-on-one. And Zoom was really uncomfortable for some people. We've got everybody who wants to come do that now able to do that comfortably. But doing the individual recordings for the audio choir, I think made people feel even worse. And so then I came and did one person at a time and helped some of the people. But that was supposed to be one of the experiences to help people feel connected that couldn't do the other. But I don't think it was, I think it was good for those who could manage it, but also maybe further isolating for those who couldn't. Yeah, thank you. Okay, so I think that's everything, and we have some time for questions or discussion if people have those.
Dr. Schauer, I think that we skipped the slide on screening questions. Is that something you could show us and talk
Yes, I felt like my navigating through the slides was not entirely successful. Yeah, I thought there was something. Okay. Yes. Let me start with protocols and then. Okay. Yeah. Okay. Thank you very much, because I had proposed some and then the conference came back and asked for us to do, I think, a couple additional. So I think I had said all participants must agree to protocols before being allowed to attend. So I sent those all to them in advance, succinctly and with no links. You have to agree to all of these things if you want to come. And so then if you agree to all of these, now you can let me know your availability, and then I'll try to rotate between the people who have made themselves available, so everybody will get as much of a chance as I can give them. So the screening questions take place outside of the rehearsal space. In our case, we have a patio that has a gate, so we used that when we were outside. And they have to give the correct answers, obviously, before being allowed to enter. And if not, they have to leave. So we haven't had anyone who's had to leave, because I also said, here's my cell phone. I've given my cell phone out to more people than I've ever given it to before. Just call me or text me in advance if you're having any problems and you can't come. And don't feel bad about that, because we're just singing unison music. So we'll miss you, but it will be okay. Did you take your temperature this morning? Yes. Was it over 100.4? No. Have you traveled outside the state in the last 14 days? No. Have you tested positive, or to the best of your knowledge, have you come into contact with anyone who's tested positive for COVID-19 in the last 14 days? No. Have you had any symptoms or come into contact with anyone who's had any symptoms associated with COVID-19 in the last 14 days? And as I mentioned, the symptoms need to be communicated in advance, and then the answer has to be no. So I assigned somebody to do this that could be at the gate, or I can do it because I have them all memorized. So that's an important part of the protocol, and thank you for reminding me. Okay, I think that's everything. So now if you have questions or discussion, I'd welcome those. I think it's important to be really strict. It's easy to think you can make an exception or relax, and no. Okay.
Great. So you can ask questions by typing them into the chat. I believe you also have a function, a Zoom function, that you can raise your hand. And if I'm able to identify that you're raising hands, we can try and bring you up on screen that way. I do have one comment in the chat, and that was from Jody Tira, who said, we went strictly to virtual. Folks love to see our choir faces. Our choir members say they look forward to recording every week. And Jody is from Desert Spring up in Las Vegas.
Yeah, I think if you can make that happen, it is wonderful. But let me share my experience with you. When we tried to teach people over our Zoom meeting one time, some of them had never made a video on their phone before and didn't know where voice memos was on their phone. And so I'd even ask them to hold their phone up, and I see that David Topping is here. So David is a tech guru. So David knows that I'm not the most tech savvy person, but I didn't know for a Samsung where to help them find it, but they didn't have that skill already to know to push a record button or how to slide over in the photo function so they could get to video. So starting from that was a really challenging level for people. And some people did it, but again, some people were then left out. So, but yeah, definitely a learning curve for ours. And the ones who successfully did it, I think would do it again. But the others, I'm so proud of them that they Zoom with us every 2 weeks. that was a big thing. Okay. I think Christina's
And
reminding.
reminder, yeah, I'm sorry, reminder from Christina, the webinar recording, the presentation material, the singing liturgy guidelines are all available on the church reopening guidelines section of the dscumc.org website. And Christina has posted a link there in the chat, if that's helpful to you. Anybody else? I'm not seeing other questions. Anybody else have questions?
If you do have questions, I'm happy for you to email me. I think I can't share it with everybody. Hi, Doug Benton. The slides are available. The additional notes that I said, if you want them, I could probably email them to you. And maybe my email address can be put up. Let me see if I can send that out to everyone. Panelists and attendees. Yeah. Okay. And for those of you that already have my other email address from Arizona, you can use that one too.
And if you're having trouble contacting Dr. Schauer, you can contact me and I'll see if I can connect you.
Yeah. Thank you. Thank you all for being here today. And we're glad we were able to share. Thank you so much for inviting us.
And I want to thank Carolyn for your time. We appreciate you being here and sharing what you do. Looks like that's all the questions for today. Dr. Schauer, Carolyn, thank you for joining us. Thank you, everybody, for joining us. We pray the Lord's blessing upon you today and ask that the Lord would smile upon you. Be safe and have a blessed Christmas. Thanks, everybody.